Welcome to our webcast, Improving Health Equity Resources and Solutions, which is dedicated to sharing tools and resources across medical and healthcare organizations. I'm Barbara Lewis, and joining me today is Asif Khan, who will discuss the color of care and health equity resources available through the documentary website. Asif is the Director of Strategy and Impact at Picture Motion, which is the leading social impact agency developing award-winning advocacy and marketing campaigns for media and entertainment, including television, books, podcasts, and films, such as the Color of Care documentary, produced and hosted by Oprah Winfrey. Asif has spent his career focused on the intersection of media, technology, and social impact. He has worked for several top nonprofits like the United Nations Foundation and Action Against Hunger, and tech-focused organizations like Do Something and Games for Change, and served as an adjunct professor at the St. John's University Graduate School of Communication. Welcome, Asif.
Thank you so much, Barbara. It's a pleasure to be here, and I really appreciate you having me on here today.
Oh, I'm so happy to have you here because I saw The Color of Care when it first came out and it was absolutely fantastic. So tell us about the documentary.
I mean, it was such an important documentary. It remains an important documentary. I love it because it's solutions focused. It not only tells viewers about a problem that is incredibly important. It's really important because it gives you solutions. It tells you about a problem, racism in the medical community in our country, which is unfortunate, exists. It gives you solutions. It gives you tools. I really, really liked it. Being the son of a physician, that it tells you that this exists, but what can we do to curb it? I really, really like working on the impact campaign because it focuses on medical students, it focuses on nurses. It doesn't point, it points fingers, but also tells you what can we do to be better. The medical community, everyone who works in the medical community, and practitioners, doctors, are doing such important work, did such important work during the COVID crisis. But it really tells them how to do better and gives them really good lessons. So I think it was really important for those reasons, and it continues to be and continues to live on. So I really, really like that it continues to educate people and continues to be a groundbreaking piece of work, both in the medical community as well as the education community.
Mhm. So let's delve into a little bit about what you did at Picture Motion and how you promoted this great documentary.
At Picture Motion, as you said before, we're a social impact agency, and what we do is take these amazing media content pieces of work and make them actionable. Stories change the world. We make sure they do. That's our tagline. So what we really do is run impact campaigns. We do grassroots screening tours. We do events. We create complementary materials, discussion guides, action guides, resource materials, websites. And for this particular film, we did all of the above. We sort of ran the whole gamut. And luckily for me, this was my first campaign in Picture Motion when I first joined the company 3.5 years ago. It's no big deal. We kind of did everything. I had my amazing team behind me. And, we have the amazing Oprah Winfrey, who was a producer and the host of this documentary. Again, no big deal. Only one of the most amazing people in the world, lending her amazing star power and intelligence behind this issue area and story that she was really personally committed to. So we did a grassroots screening tour. I'll start with that. I had the beautiful sort of responsibility to, first of all, craft a medical advisory board. I'm not a physician myself. Like I said, I'm the son of a physician, but I'm not a doctor myself. So I seeked out to reach out to doctors, nurses, academics, or people working in academia, such as yourselves, to figure out who can advise us on how doctors, nurses, folks working in academia can use this film, or will they use this film, or how can they utilize this film to bring it to students? How can they bring these guides to students? How should we write these guides? Basically, to educate us to run the screening tour. So even before we start this campaign, we do an impact strategy period. our homework, so to speak. So we did a 2 month strategy period to sort of do this whole period. So the medical advisory board was sort of step one. Once that was formed, we started our screening tour, which was a 6 month screening tour where we did screenings all across the country as well as Canada, because we did have a lot of interest from Canadian schools. There's obviously a lot of different parallels between the United States and Canada. We had the amazing partnership with AAMC, which is an organization that has a lot of different schools, medical schools as well as nursing schools. So they had screenings with various different medical schools. So it's really important to have promotional partnerships with organizations that have sort of large megaphones where various schools can come in and look at this film and potentially adopt it into curriculum, which is a big win. So one of the things I was really doing is to take this film to organizations that could take this to large numbers of organizations and schools. So that was a big win for us. I think the other thing that was really important for us to have very, very actionable items in our discussion guide, which you can see on the website, thecolorofcare.org, which has a lot of different resources, which we'll talk about in a second. And then lastly, social media. I think it was really important for us to have some really actionable social media items as well as toolkits. So I think all in all, we wanted to make sure that everything was signed off by the professionals, which is the advisory board. But in essence, it was also actionable as well as very, very relatable to all the different audiences we had. And chief among them were the medical students as well as the medical professionals. And within that was always people working in the hospitals as well as the nursing students and nurses.
So you mentioned the Color of Care website, which has a lot of resources on it and tools and solutions, as you talked about. But it also has the free anti-racism module, which was funded by the Josiah Macy Jr. Foundation. I was wondering if you could talk a little bit about the resources and tools that are available.
Those resources were such an excellent find for a variety of different reasons. Number one, they were free and they were found online. Everything that I put together, being head of strategy and impact, number one, the one thing I look for is that it's free and readily available. I like not to have paywalls behind the content I put out. Why? So that everyone can access it. Obviously, there's a lot of really excellent content behind paywalls. I don't want to discount that, but I want to make sure that anyone who's accessing our content can do so besides having any paywall behind that, because so that it's accessible to everyone. So the free is key there. Aside from that, it's very, very high quality. It was thoroughly researched. Our advisory board was definitely behind it. They vouched for it, and it was very well done. It's still up there on our on the website, and I think that the hits speak for themselves as well. We did metric testing every couple of weeks, and in general, I think the content speaks for itself. We also use a lot of that content in our social media as well as our toolkits. A lot of that content performed really well when we did testing with different focus groups. So props to the foundation organizations that put that together. And I'm really glad we're speaking by right now, because it really speaks well to those foundations, and that content snowballs and kind of gets used in these toolkits and social media. So really thank you to that foundation for putting that together, and thank you for bringing it up again in this interview, because it's really good that it's used and put together, because it made my job easier to put that on there and for folks to use it. And then it's going to continue getting used as folks hear this webinar and continue to use it forward.
Now, what feedback did you receive regarding the Color of Care?
The number one feedback we got was that the fact that it was solutions focused and led with positivity was very, very useful. As someone who was in New York for the large part of 2020, doctors and nurses and friends of mine had a very tough job, much like a lot of other people that year and years forward and beyond before. So leading with care, we all rang our pots and pans all over the country, all over the world, leading with care, leading with gratitude. This was a tough film. It was a film that, had a lot of anger in it, and, it had a lot of pain in it, a lot of suffering in it. So this campaign had to lead with solutions, had to lead with gratitude, had to lead with thanks, but also had to lead with what can be done better, what can the new generation do, what can the current practitioners do. So I think the campaign really focused on this was done, this can be done better. So I think the campaign really led with care, gratitude, and rectifying mistakes and kind of changing course. So I think that was definitely number one. I think number two, people really appreciated the the freeness of it all. So the 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 various the lessons and the course plans you mentioned earlier and the resources you mentioned earlier were free. A lot of things aren't free in the medical world, obviously, as you know. um, the fact that all the screenings were free, the fact that all the resources were free, the screening tour was free, all the impact agency, the services that we provided were all paid for, by the Smithsonian, by Paramount, by Harpo. All of that was covered. So when we worked with all these medical schools, all the nonprofits, this whole campaign was free for all the people who did the screenings. So I think that was a really beautiful gift that we provided them. They're already doing amazing work. So I think that was a really nice gift to them as well. So I think those two components really did well. And I think just leading with care and gratitude, I think people are doing really, really tough work. So I think those two were definitely shown. And yeah, so I think that's something that continue. I think the campaign continues to live on. Like I think 3+ years. This is my first campaign. I think I'm 3 years and 4 months into my job now. So, and I still hear about the color of care all the time. Like TCOC is still in my head. So I just think it's one of those campaigns that, um, you know, I don't think we sort of moved past COVID as a world, but it still remains in our head. So I just think continuing with those positive messages that the world came together in unison and sort of beauty and positivity in some ways. Those are messages that continue to come across.
Mhm. Mhm. So the documentary is now free on some websites. Do you want to share with us where it's free so people can watch it?
Yes, of course. I will be sending you some links so you can add them to the postscript for this webinar. But it is free on Amazon Prime for those who do have it. So if folks want to go to your Amazon Prime, it is free. You don't have to pay for it. You can see an extended clip on YouTube for free as well. So all of you have YouTube. If you don't have Amazon Prime, you can also Google the Color of Care Smithsonian. You can see some extended clips there as well. And then you can also go to thecolorofcare.org and you can see the resource pages there as well.
Right, and that's where the free anti-racism module and other resources are also located. So there must have been millions of people who have seen this. Do you have any idea about the reach for this documentary?
We don't have exact numbers on the reach, but I can definitely follow up on the exact viewership numbers. We can get them from our colleagues at Paramount because there's a lot of different platforms, including YouTube and their own platforms where this film was shown, because we wanted to make sure this was shown in different ways. So I want to get the correct numbers. I don't want to misspeak. So I can definitely follow up with those numbers with you as well.
Well, I'm saying millions, probably. Well, you had all those free screenings everywhere, and that's how I watched it. I signed up for a free screening through my school, and it was just a fantastic documentary. But I'll tell you, I needed tissues. It was very sad. Some of the things that were the stories were just very sad, but lots of solutions, which I loved because the first part of it was the issue, the problems, and then the second part of it is, okay, we've got this. What do we do about it? So I love the idea that the second part of it was all about the solutions. So talk to us a little bit about maybe some of the toolkits or some things that are available that people can use. And I'm assuming since this is all free and not behind a paywall, that other organizations can have links to them so that their constituents can also access these great resources.
Yes, and I can go back to the numbers of the picture motion impact campaign because we do have those numbers, and I like to speak about true numbers because I am the head of impact and strategy, and the impact is, impact should be true, and that's kind of my motto here. We did have in our particular impact campaign on picture motion, which was finite, we had 3,500 clicks of our discussion guide toolkit and interest form and resources. We had 200,000 plus partners and organizations engaged in our screening tour and promotion. We have 130 plus confirmed marquee screening events and grassroots screening partners with 5,000 plus estimated audience members across our screenings that Picture Motion planned. And then we had 13,000 plus people visit our digital impact hub, which is the website, thecolorofcare.org, that we talked about. And then can you repeat your question again, Barbara? Sorry, I just pulled up our data sheet as we were talking, so I could
Oh,
give
I
you
was just
true
curious
numbers.
if there were any toolkits or any resources that you might want to delve into a little bit, because I'm thinking that people in other organizations can link their websites to yours and say, here are some resources to that their constituents can use.
Yes, I think the color the colorofcare.org, the resource page has a collection of resources, which is the best hub. When we did the resource page, it is linked to, I want to say 12 to 14 various other organizations, including the ones you mentioned before, and some of our partners. So that is the best collection because I spent a 3-month period looking at other organizations that deal with COVID, that deal with obviously, different medical emergencies, as well as anti-racism efforts. So that is the hub that we sort of kept, and we kept it current since then. So I would say that's sort of like my Bible, so to speak, of resources for organizations. So I would refer back to Color of Care.
Yeah, and the resources are extensive on the website. And as you mentioned, toolkits too, which are important. So do you have any plans for the future for any other equity resources?
We are an impact agency, so we work on various different campaigns focused on various different films. Our website is I was going to say thepicturemotion.com, so colorofcare.org, but it's not thepicturemotion, it's just picturemotion.com. Our social is Instagram, Citizen Picmo. So we have various campaigns at any given time. We do have some health equity campaigns coming up, so keep an eye on our socials. Health equity, fortunately or unfortunately for our country, is an issue that comes up all the time. So we will have some more health equity campaigns coming up. We don't have control of what kind of films we do have coming up, but I do have some window of more campaigns coming up in health. We did work on a campaign similar to, again, a beautiful story on solutions of equitable care, a beautiful story on how two people come together on providing very good racially equitable care in the operating room. So we can provide more on that on a sequel to this. But yeah, more on that hopefully in a next conversation. But yeah, hopefully we can have another conversation. But
Sure.
like I said, Picture Motion, we do a lot of different campaigns, but if you follow us, we can definitely tell you more about our other campaigns.
Good. So if somebody's embarking on a journey to provide health equity resources, what would you recommend to them?
Journey to provide health equity resources. I think the best thing would be to see what organizations are leading the charge in the particular um in terms of, for me, when I reached out to various organizations, I started with who worked on advising in the film. I reached out to the various organizations who were interviewed in the film from the health equity side. There were 4 or 5 different organizations who were, first of all, interviewed in the film. I obviously watched the film first. I looked at everyone who helped with research. I reached out, obviously, to the producing team. I reached out to everyone who was um, involved in the making of the film. I interviewed them. I looked at everyone who, um, in addition to who they interviewed, and I also looked at their research list and then kind of continued that journey. I think research is very, very important. The National Community Reinvestment Coalition, NCRC, was an organization that was really important. The Health Equity Resource Center is an organization that was really important in my research. And then the National Rural Health Resource Center was important to me as well. So those 2 organizations came up in my research. They were also recommended to me by our medical advisory board, which is still listed on the resource page that we talked about. So I think, first of all, if you're working on a particular project, start with who their project producers already have, and then continue on that research process. So I think that's the sort of what I use personally for this. But in addition, every project can be different, but it's always good to start with the framework that has been set already, and then continue on that journey from.
Well, you did say that you spent 3 months looking for resources to add to the website. So I think that probably on the colorofcare.org website, there are a lot of resources, and that might be a place that people could easily use to incorporate into their own resources as well.
Exactly, and all these aforementioned resources I mentioned are there, and that was kind of my path to get them there.
Right. Yeah, very important. So is there anything that you would like to add before we wrap up here?
Um, I think I think one of the things I would add is this is tough. It's tough work, and it's important to find joy in it. It's hard because people lose their lives. They have lost their lives, and wherever you can, it's really important to take space for yourself, take a breath, take a walk, have a drink, have a coffee, have a cocktail, whatever your poison is, so to speak, like, have an ice cream sundae. For me, my mom's a physician, my grandmother was a breast cancer survivor. I find like the beauty in it, or the joy in it. I find I do this for women in my life, or I kind of like see this as a gift I'm giving to like people in my life. So my mom loved that I was working in it because she's a physician. She just retired. I use her as my free consultant, so to speak. And our mom and son talks are like, she loves it that I'm doing this work.
Mhm.
And, she like loves that I'm asking for advice. And even though she's a cardiologist, like she'll give me her tips, and I take some of them and I don't take half of them. So just, make this, I don't want to say fun for you because sometimes it's not fun. It's serious work, but just try and find lightness in it because it does get really heavy.
Mhm.
So respect it because it's really important work, but just find, luckily for us, Picture Motion is a company that really values your mental health. And we do get free mental care therapy. So if you don't have it, advocate for yourself, find that space, take that mental health walk. So that's really important. So I always give that advice. So that's what I would end with.
Oh, thank you so much. It's a great suggestion. Thank you, Asif.
You're welcome. Such a pleasure. Thank you so much for having me on.
You've been listening to Asif Khan discuss the documentary, The Color of Care, and health equity resources available through the documentary on their website, Improving Health Equity Resources and Solutions. I'm Barbara Lewis. Thank you for listening.